Hi everyone, and welcome back to the first of our jam-packed afternoon sessions. Just as a reminder, this is a live panel, so please do ask your questions for all our fantastic panelists. We will do our very best to get to them, but we've also got a lot of content to get through. So with that in mind, I'm going to hand you straight over to the fantastic moderator for this session, Key Success Factors in Femtech Fundraising. So Peyton, over to you.
Great. I think I'll dive right in. I wanted to ask my first question to Shilpa Patel, the Chief Business and Legal Officer of Kindbody. I'm sure this is relevant for everyone on the panel, but I was wondering if you could take a few minutes to kind of talk about the biggest challenges you faced as you've gone through your fundraising efforts.
Yeah, sure. So just a little bit about Kindbody. We are a women's health and fertility company. We own and operate our own network of clinics across the United States currently, as well as administering and managing fertility and maternity care navigation benefits for large employers and mid-sized employers. The challenges that we face, I think this is probably similar to all of us on the panel, is just a general, the typical challenges of fundraising in the women's health space. We are, like I said, a women's health and fertility company. We kind of get boxed into this, into a box of women's health, of which there are many types of companies that meet or provide different services or products within women's health. And oftentimes in our fundraising efforts, there's kind of this check the box mentality of, we need a women's health portfolio company, and Kindbody, are you it? That's really, and rather than Kindbody, we're really invested in what you're doing in delivering better access to fertility and family building services, as well as broadening the scope of women's health, from prenatal through postpartum, which is what we're focused on. As background, we've raised about $125 million to date from Google Ventures, Perceptive Advisors, RRE Capital, and we've specifically chosen these partners because of their direct and kind of genuine interest and support of what we're doing versus really there are a lot of firms out there, like I said, that are kind of looking for that check the box, looking for that just general women's health investment, and not as invested specifically in what we're trying to do. So we've chosen partners who are true partners, and I think that's really my long way of saying that's my advice. The challenge is finding that true partner who's truly invested in what it is that your company's doing, and being selective in the process.
Awesome. There's kind of two jumping off points from that I wanted to explore a little bit more. I think, Debbie, I'll roll over to you. Debbie Garner, CEO of FEMSelect. So, there's fundraising in Femtech, and then there's fundraising outside of Femtech. I mean, they don't have to be different, but it seems like, there's a perception of difference. And I'd love to hear a bit of your thoughts about whether you've seen that and kind of pick up from there.
Sure, yes, thank you. I would actually say that seems to be a very big difference between women's health. And the reason being, I think, is that until recently, most investors that I sit in front of tend to be male. It's changing slowly, but it's changing. And when you sit around the table, most of them are not nodding their heads in agreement with you about the problem that you are trying to address. And I think that's the biggest thing. Maybe Shilpa was referencing that as well with fertility, but maybe with fertility, they've been involved in the process, or they've been knowledgeable of the process. We at FEMSelect are approaching prolapse, which is not even a term many men know. They probably wouldn't have even talked to their wives or mothers about it if they had that issue, because it's an embarrassing topic to discuss. It's when the pelvic floor sags or drops, and even my girlfriends might not even talk to me about it, so it's embarrassing. And so when investors cannot sit and nod their head with you, they just think it's a small market or that it doesn't exist. So, and I'm sure everyone on this panel probably can agree with me, we've been told many times we are a niche market. Now, nearly 50% of women will have a pelvic floor issue in her lifetime. I don't know where that's niche, but that's what they think. So it makes fundraising difficult because, right now it really is a buyer's market. There's many opportunities for them to invest, and they can pick and choose. So if they have to choose over something that's a recognized problem versus something they don't know, then that tends to be, I think, where they go. I think the other part of it is a little bit more technical around, why folks invest. They invest to make money, right? Let's, not kid ourselves here. The exits in women's health have traditionally been much lower than exits in men's health or exits in other areas. So depending on who the investor is, if they're focused only on health tech or healthcare, they're going to look for where they get the biggest bang for their buck. Cardiovascular devices, even BPH, where we're up against, there was $1 billion exit in BPH. We're looking at comps in women's health in our space that don't pass $200 to $300 million. And so then they say, well, I got, 2 companies. Well, I'm going to go with the one that's probably going to give me the higher exit. And so it becomes like a self-fulfilling prophecy.
Yeah. And I guess roll over to Shailja, Dixit, CEO of Curio Therapeutics, for that last phrase from Debbie, the 2 to 300, not crossing the 2 to 300 exit realm yet. And my question there is, on the self-fulfilling prophecy, it seems like the industry is still in its earlier stages, which means it's, pointless to hold that against them because you need to have more funding in order to create those bigger exits. Like how have you seen, the market experience of total addressable market or the horizon, and how to deal with those discussions as you've gone through your fundraising efforts?
So thank you. Nice to be here. Just a little bit. I am Curio Digital Therapeutics is focused on mental health for women, delivered digitally. And again, I think to Debbie's point and what Shilpa said before, I completely agree. I think one of the things have been, as you said, definition of the Femtech itself, right? So adding on to what they said, not having enough people on the other side who understand the problem statement, having a definition of total addressable market and what Femtech has also been something that we had to think through, because there are so many flavors of Femtech. Are you talking about something which is direct to consumer? Is it like a technology or a medical device, or is it something software as a medical device which is regulated? So defining that total addressable market and making sure that there is an understanding of that which you can cohesively articulate to your investor it requires thinking. The good thing is I think we are seeing some momentum, and more light is being thrown in this area. So it's all in positive direction, but we do need enough examples to do that right benchmarking for people to understand the total addressable market well. So for example, in our instance, again, it's mental health. With pandemic, we all realize the importance of mental health and how ignored the mental health was. So at least there is some realization in that area. But before that, when you talk about mental health, these are not the biggest cost driver, and then you are talking about postpartum depression, mental health. I had been in situations where literally I had that, but everybody has that. Is it like even a condition, right? So I'm just talking about just making sure to understand and articulate what exactly is the, and on the other hand, the prevalence can be as high as 16 to 40%, and not realizing that it's that big a problem. So we had initial challenges, but I think we are seeing more and more light in this area. So you need to be very thoughtful when you're talking about your total addressable market, get the numbers, and it does require, I think, 1 or 2 rounds of convincing that even the problem statement does exist and there is a market out there. So, but numbers speak for them, and I think there is a growing understanding in this area.
And Raoul, I wanted to loop you in as well. Raoul Scherwitzl, CEO and co-founder of Natural Cycle. So we've hit a couple of topics, but I wanted to give you a chance to respond to any of those, either the challenges, the addressable market, the differences, and loop you in here.
Yeah, overall, I agree with everybody what they said here. I think what resonates most with me is also the need to educate. I think that has been something. So Natural Cycles, it's doing a birth control product, the first one that has been FDA cleared and CE marked, and we also have solutions in fertility. And I think there was always a need to educate the investors a little bit on it. So it naturally shrank the pool of investors that were like willing to move over. And then, you needed to find those that are really passionate about this. And there are those investors. They've always existed. We've been at it now for 7 years. We raised 4 rounds and we've always managed to raise. But it does indeed shrink very quickly down to a few investors. Having said that, I do see also I do see a very positive trend in the area, right? Like women's health is really having a moment. It's being recognized as no longer being niched. At least there's a lot more being talked about it. That it's not niched. It's half the population. They make the decisions in healthcare, and I think there's a lot of momentum right now in women's health. Good companies are getting funded, and good companies are exiting. And some raise really large rounds. Some have exited, at good values, and so Progeny is on the stock market at $1 billion value, and then Modern Fertility and Ovia just recently sold. So I think there's and then a lot of great companies are raising a lot of money. So I think there's much more momentum over the last 2-3 years than it was like 5-6 years ago. Having said that, I've only raised money in women's health, so I cannot really speak to how it is in other fields. It just often feels that there's also like this social component a little bit to it, that there's always some, like, we never fly through the IC meetings, the investment committee meetings. There's always someone that has a very strong view on it and is opposed to the approach that we have or something like this, and that's a little bit like that is I think also the nature of the topic that we're in. We our flagship product is birth control, and that is always a little bit polarizing. It comes with controversy. Everybody has something to say about it, and that I think makes it that makes it difficult. That adds to the difficulties. But overall, I think you just have to plow through the process and deal with it. And in the end, all the companies that are around here, they've raised rounds and they'll continue to raise rounds and do a good exit, I'm sure.
So you raise a point I wanted to come back to as well, and that's, there are groups of investors that are very well educated in, your spaces, but there's also general investors that have some knowledge, but not as deep as some others. And, as you mentioned, these IC meetings tend to have some difficulties to them as you're getting people up to speed and educated about not just your company, but the space. But Shilpa, I'd love to kind of get your thoughts on how you've approached those difficult IC meetings and how you would recommend to people out in the panel to kind of approach those educational moments for your investors.
Yeah, I think we've kind of, both Shailja and Raoul sort of spoke to this, that there is more, I think the trend, we're really on a precipice of investors understanding the women's health market better, understanding that the differences in these women's health companies that they're speaking to and looking to invest in. On the fertility side, as an example, we're finding that more and more at a lot of these meetings, they're primarily male partners. The more and more people just generally have had some exposure to infertility. And that kind of personal experience or that personal understanding lends itself well to kind of educating them on the need, on what we're, on our business model, on what we're trying to how we're trying to distinguish ourselves in the fertility and family building space. We also have, like Raoul just said, we have Progeny is a great example for us to kind of prove our proof of concept, particularly based off of their success. And one of the in terms of to take one step back in terms of the educating, there's usually one partner at these meetings who's really leading, obviously, the investment. Oftentimes what we find is it's a female partner. She's struggling. She oftentimes struggles to prove the value of the investment. And we're kind of having to jump over 2 hurdles. One, just generally educating in these meetings, and then also with the lead investor her own hurdle of kind of getting buy-in from her partners. And I think that is changing, and I do believe that investors are better educated. They have personal experiences in the space, not just in fertility, but in other aspects of women's health, and they do generally understand. I say this and then I'm going to kind of take it back, but they generally understand that the differences in women's health companies. That being said, many VC firms particularly are kind of looking that once they have one women's health investment, it's kind of as if they've sort of made that investment, and they're not really understanding that women's health is a large genre, and there is the ability to invest in multiple women's health companies that don't necessarily conflict with each other.
I could add to that, I think, if I may, that sometimes it helps to take a step back, even when you're approaching an investment firm, and look to see, the backgrounds and bios of all of their partners. Look to see if they have any interest in women's health or in women's organizations. Look to see if they have any portfolio companies. And actually, I found maybe the opposite of what Shilpa was saying is that if they have some experience in women's health, they're more likely to kind of look again, maybe because we're in pelvic health, so it's a little bit different. If they have a fertility company, they might be thinking of the other end of the spectrum, menopause, et cetera. So I look for someone who has a sensitivity towards it, and then it makes it a little bit easier, because I find it's even harder to get it, right over the goal post if there's no kind of reception to it.
For us, the partners that were the best at championing our case were often partners that where the wives were users and fans of our product. So that was for us a learning over the years, that those ones they were often big fans of natural cycles, because they've seen their wife use their product for birth control and then fertility, and that was an interesting anecdote that I thought I'd share.
Shailja, just want to give you a chance to add in on this, if you would like, for the education session, if you will, and the difficult conversations with those investment committees.
I think few things that have helped us is we leveraged data, and we did a lot of data digging to show the unmet need. Like, we did analytics on some payer claims data, some employer, data, and so on. So we had to do some extra effort. I think one, as Shilpa was saying before, that if somebody is in the committee who has gone through that experience, that speaks a lot. I think that is usually a starting point of some discussion where say, oh yeah, I know someone, or I have gone through it, or I know there is a problem. At least there is an acknowledgement then. Then I think one thing which we took was we went back and we looked at a lot of data, and we did a lot of analytics to run our data to figure out and make our case. So that's another thing I want to emphasize, that data and analytics does make a difference. And, if we can present more data, during the meetings and discussions, that helps a lot.
Awesome. So another item I wanted to chat about is we spend so much time for the current raise that we're doing, but then there's always that next one, until everyone's cash flow positive and you don't raise again, but that's an elusive time for many companies. So the question I have is, like, how quickly after you do your current round are you already thinking about what the markers are for doing your next round, and like how you've kind of go about assessing that? I know it changes at stage, so each of you will have slightly different answers to that, but I'll turn over to Debbie first for how you think about your goals for that next marker for the raise.
Sure. Thanks, Peyton. Well, I may think at the earlier end of the companies on this panel today. We are a commercial stage company, but only 1 year in, and we're just about at our Series B. But I would say it happens from one raise to the next. It almost flows into one, because when you're out raising for one, they're already telling you what they think the milestones are for the next, or somebody passes on it because they say, you're not there yet. And we're certainly in that situation now. We're raising a smaller round to get us off the ground commercially, but we've already been told, by many VCs, you need to get to a $5 million run rate before we can look at this again. And so that already kind of paces you for how you can get there and when you can get there.
I'll roll over to Shilpa for that.
It's similar response, but yeah, in generally, as Debbie kind of said earlier, the investments or investors are interested in what the exit will be. So in that investment round, it's typically, okay, this is what this round is kind of to get you here, and forward thinking that your future rounds will get you. Where are you trying to, what is the exit basically, and how are we going to help you get there? And that's always kind of forefront of mind. The other thing I think to mention, and that is that, as Raoul just said earlier, a number of women's health companies have had large raises recently. I think the market is pretty frothy. I think that the investors are certainly, or investment companies are certainly interested in making investments in women's health. And I think it's really a ripe time to fundraise, even if you're not necessarily needing the capital.
Awesome. Raoul or Shailja, any differing or complementary thoughts?
I think, I'll just highlight one point that Debbie said. I think a lot also depends on the stage that you are in, right? We are also in the earlier stage. I think, what I learned was that at least in the early stage, you don't stop your fundraising discussion till you reach a point, I guess. So I think that's very important aspect. And it also depends who you are benchmarking against. For example, we are going through a regulated route, so the benchmarking is very important versus when you are looking at something which is direct to consumer. So what is the inflection point that investors are looking at? You need to make sure that you very clearly articulate that and benchmark properly that, okay, there is a DTC, then there is a regulation. So my inflection points and what my milestones are going to look different from someone else, so that those things are really important to define your benchmarks, define your roadmap very clearly from get-go during your investment discussions. But again, as I said, I think in the early stage, you don't stop that discussion. When you are talking about seed, you had people who were already talking about seed will come in early Series A or A, and these are the things that we are going to look at.
Awesome. And Raoul, I'll ask you this next one. I hear from many of my clients frustration about how much of their time is really spent fundraising versus running their business. And I think you mentioned you've been through 4 rounds. I was curious, like for you, how much of your time is split between the fundraising efforts and running the business, and how you deal with that tension and the push-pull?
Yeah, it's a lot. I think I don't really keep track of it. I would maybe put it to 50-50, running the business, and then 50% outside, fundraising, talking to corporates and so on. But it's also part of the job, right? This is the job. So I personally enjoy it, right? Like to package all the great work we're doing and getting the feedback from the investors, and that also always shapes you a little bit and shapes your focus as a company. So I think it's part of the work, and it's rewarding work. Over the years, you also become a little bit more efficient at dealing with investors, and aiming for speed and efficiencies, having materials ready, and different stages of materials ready of quality that you then continuously update, as time passes and you get feedback, even if you're not raising. I think it's always good to have those things ready. And so yeah, I think it is a lot of work. There's no way around it, but it's I think it's also something that is good.
How about the rest of the group? Like how have you managed this push pulls and the challenges of, only so much time in the day to manage those two areas?
I can take that. I fully agree. I think at least 50-50 or maybe more, depending on, which stage, so it goes in up and down. But I think those are, that's important, that's pertinent. It also is an opportunity to learn, because you do get feedback. Sometimes when you are inwardly focused and you're looking at your team and doing the work, you don't get that outside honest feedback. So, presenting to investors is also an opportunity, at least we have used, to come back to the drawing board and see that how our story, if at all, needs to be tweaked, and what we need to do in our business planning process as we are talking to these investors. So I use that opportunity as actually a two-way process. That's how we have used it, but it does take time and effort. Another important thing is, and I think I'm at the earliest stage out of all of the panelists here, having a good team helps a lot, so that I'm not worrying about it every day. I know that there is team members who are able to operationalize while I'm externally talking to investors. So I think those two things are important.
Yeah, and I'll step in. We try to run a really tight process, and really kind of are organized about it. And our goal is both to run an organized process and also a short fundraising process, so that it doesn't detract from running the business. And then also limiting, obviously, a subset of people who are kind of involved in the fundraising, and making sure that others who need to focus on running the business are able to do so. But I think that's key, is kind of running that tight process and really being organized about it, and trying to, we give ourselves internal deadlines and give the investors also kind of an idea of what our deadlines are, so that we can really run this concise process versus letting it kind of linger.
Awesome. I'll ask this question for Debbie, and I would love to hear everyone else's thoughts afterwards. But life's full of surprises is something that my family always told me growing up. What are some of the biggest surprises you've seen so far in your journey in this space?
So I think one of the surprises, and again, based on our experience in a very kind of specific market, we're in not only devices and women's health, but pelvic health, like I said, not known to many, and no AI and no digital health, maybe considered a little bit more old fashioned, despite the fact that we have, great innovation. I think the surprise is, if you're not the new shiny penny, it doesn't really matter what you've got. Sometimes you have to be creative and innovative to kind of get to where you're going. I say that because, like I said, we're a traditional medical device, and we get to know a lot at very early stages from folks. And here we have a company where we have a product. Okay, so it's in commercial stage now. We have FDA clearance, we have CE mark, we have initial clinical data, and we're running a post-marketing study. And my surprise, as I call it, the goalpost keeps getting moved. So, we had FDA, and investors said, okay, we'll join you then, or then we get CE mark, and then they move the goalpost again. And so I think for us, the learning is that we need to find the right investor who is involved in our innovation and interested in what we have to do and the impact that we feel we can make for women. Because otherwise, some of those investors will just kind of keep you dragging on, keep you thinking that they're going to come in every time you get that next milestone. And I think the learning for me was just to find other investors who would be more interested in what we're doing.
Awesome. How about for the rest of the group?
I think FOMO was a big surprise. I mean, I know people talk about it as almost as a joke, but it is, or you can put it differently, like just interest in your company and sharing that interest with other parties, that there is interest in your company. That does make a difference quite significantly. And I've had raises where there was a lot, and I had raises where there was none, and it's really a huge difference of how how it helps you to, in terms of speed, to get it over the finish line, the terms, and so on. And so I think you're trying to steer up that interest and get a term sheet quickly, I think is like I think a big driver for success, I think. And it was a big surprise to see how strong that actually works.
Shilpa or Shailja?
Yeah, I would, I think Debbie and Raoul say that. So kind of like resonating, finding the right fit, I think is the biggest challenge, So first we were just, going out and talking to many, and it was very clear to us very quickly that we have to do a little bit of a analysis to understand the right fit, and I think Shilpa said also, one thing very interesting, sometimes you find right fit, but they have checked off that box, and it's just a checking off the box. We have one, women health or Femtech in our portfolio and move on. So that was, I think, one of the important things. And second, I think challenge was, figuring out and articulating the right business model, because this area is still so new, like, what is the monetization and commercial model, and looking across in the industry to find right benchmarks that have been successful. So I would say those two things, finding the right fit of investors and then making sure that, there are those who understand the business model. And every Femtech has a very different business model, right? So figuring out the right benchmark and just having that argument ready was another second one, I would say.
Yeah, and I mean, I think I'm going to kind of echo what Raoul just said. It's really there's this element of FOMO and the interest of, in this space, particularly in the family building space, and the precedent of success of a successful IPO of a family building fertility company has really kind of I would say from our Series A raise to our last raise, which was our Series C raise this summer, it's really the attitude, or the interest, I should say, actually, rather than attitude. The interest has significantly increased in that time period. We raised our Series A in 2018. It closed in 2019. And in just a short amount of time, but it's enough time, the interest in family building and fertility specifically has really increased, and the level of understanding of the type of companies in the space has also really matured. I think, when we first went to market, we were kind of boxed in as you're a healthcare provider, you are operating clinics. Now there's a much better understanding of we're more than we do operate clinics. We are a healthcare provider. We are also directly contracting with employers to manage their fertility benefits. It's a much bigger space. It's a much larger total addressable market. We are also, in addition to fertility and family building, which is our core services, we've built out a virtual platform treating patients from prenatal through postpartum. We focus on full spectrum gynecology. There's much more to what we're doing, and the understanding of that has really, it's improved, and the number of I go back to sort of the female partners at a lot of these investment firms very well understand what we're trying to do and are really kind of advocating internally for investments in this space.
So I know we've touched on this a little bit about, the market is not as well known on all the contours as maybe some other markets. Like how have each of you kind of gone about addressing total addressable market? And how important have you found getting some consensus around that number to be to your fundraising journey so far? I ask that just because some companies I've worked with have, it's been irrelevant to their journey at the beginning. But I feel like in other areas, people have used that as a pushback, almost an artificial pushback. And I'd love to hear your thoughts about it. I guess I'll go with Raoul first.
Our product is, our first product was a birth control product, a hormone-free yet effective birth control product. that we built from the ground up, and then we saw that 60% of our users came off hormonal contraception and wanted to switch over to something non-hormonal. And so then for us, it was actually pretty clear that this was a massive global opportunity, because just look at how many women use the pill, and then you see what fraction we get from the pill, and then you run surveys that try to address how many women would be interested in that. So I think that was always clear that it just had a lot of scale in terms of numbers of users. And then our direct to consumer approach also, the benefits of that approach was that you could really quickly reach them, in many geographies, and learn, how to find the best users and so on quickly. So I think I will leave it to other people on this panel, because I think the total addressable market and the market sizing was not, I think it was clear that it affects every woman's life at some point in her life, for a few decades. And I think that people understood. It was more the pain point, I think, or the problems of how unique and how difficult it is to reproduce. Those sort of the things that were like the things that we with Natural Cycles had to put more effort into explain. Yeah.
Cool. How about the rest of the group?
Yeah, I could add, I think we're on a journey, because I think, I don't think we've gotten where we want to go with total addressable market. If you look at the numbers of pelvic floor procedures in the United States, for example, there are only about 350,000 procedures a year, but yet we know from data we've done and all over the clinical research, you can see there's over 3 million women in the US who are diagnosed with prolapse, and then there's millions more who are sitting at home and just don't even have a diagnosis. And we know they're out there. We've done some testing of our own to gather that data. As Shilpa just said, data is very critical, but you're looking at only about 10% of the women even seek a solution with a permanent treatment. So it's really a struggle, because when you approach an investor, they look at the current market and they say, well, how many of those procedures will you take over, and how many years, and what will be your share of market? And we're going for something much, much bigger. We offer a minimally invasive option that doesn't exist. Difficult to tell an investor that you have really no competition, but we don't. And so we're kind of unique in our category, and we have to really educate them, as been said many times on this panel already, but educate them on what our solution is, why we think that it will expand the market, bring them examples from data, bring them examples from KOLs, but it's a process, and we have not completed it. We're there. You can do bottom up and top down, but if you look at top down, 50% of women will have a pelvic floor issue, but getting an investor to see that gap between 50% of women and 300,000 procedures is a journey. It's a long way. And some we've convinced, others we're not there yet. And I think Raoul said it earlier, if your wife or mother had that issue, then you really believe it and you're nodding your head from the minute you start talking to me. But others, it takes longer for them to see the opportunity.
So another question, I guess, in the last few minutes we have here is, the fundraising world today is obviously massively different than the fundraising world of like 3 years ago, for a variety of reasons, but one of which is like the literal execution side of the process, like, flying all around the East Coast, West Coast trips versus Zoom. How have you found the current Zoom version of it to be, from a better or worse, or any unexpected benefits it's unlocked for you that you wanted to kind of let the group know at home, as to educate them?
I can take that if that's okay. I think there are pros and cons both. So the good thing has been that as a newer company, we didn't have to fly around, and that 50% spend becomes 100% if you include all of the travel as well, the time spent, right? So that has been the good thing, that you can do a lot of these things. Also, it increased the reach. You can go all the way from Europe to West Coast and just sit in your home and do those on Zoom meetings. That's the positive part of it. The negative is actually when you are a first when people are getting to know you and the company, they want to meet you. It's once you are established, I think things become a little different because they know that there have been others who have invested. So we did have challenge because they do want to meet you. They want to sit down with you and have a feel of the founder and the CEO. So that did pose some challenges as well. There were few who knew us from the previous history, who were the one who stepped in first, rather than just looking at new investors who had no idea or who we didn't have any relationship with. So I would say there are pros, but there were also some challenges that we had to overcome.
Shilpa, I thought you look like you may have a few thoughts.
Yeah, I agree that it's certainly easier to schedule. It's easier to reach more potential investors or prospective investors at home via Zoom. But there's something to be said about in-person meetings, and really, I prefer, and I know that others on our team really prefer to have these meetings in person. We're much more charismatic, and the meetings are also more lively, and it's really easier to kind of sell your product or sell your services in person than it is via Zoom. Something kind of gets lost, and so I hope that we go back to in person soon.
I think the flip side of what Shilpa and Shailja is saying, that it sharpens the need for really good materials. So you only get one shot, so good materials, complete control of Zoom, make sure you're in a place where you have quality internet. I mean, you have a bad Zoom, it's just probably not going to go anywhere. So it sharpens the need for everything to be crisp, your marketing materials, your invitation, making sure, again, the internet is working, you have a data room that's up to snuff, and making sure that all your materials are completely ready for the digital age.
One thing I've seen from investor side clients of mine is, several of them have mentioned they are willing to take more of those initial Zoom meetings than they would have in person, just from a schedule perspective. Like, have you seen this current timeline kind of enable you to broaden the first pass of who you may reach out to? Because I think everyone agrees it's ideal to get the in-person, but it seems like there's kind of an evolving trend of, and this may query whether you think it's going to survive post-pandemic, of more first pass Zoom, second pass in person, and how you've seen that change. And it looks like you may have a thought or two on that. So I'd kick to you first and then go from there.
Yeah, I think before the pandemic, I barely remember, but I think it was you started with phone calls, or I don't know if we used video calls.
Yeah.
I cannot remember now, but I think that's probably what's going to converge to, that you're going to start with that you're going to start either at, on Zoom, or you meet at conferences, and then you have follow-ups, and when you get close to it, you'll meet face to face to get the personal interaction going, because it is still a partnership. You're going to be working together for half a decade at least. So it makes sense also to do that extra effort, but you don't have to fly around, which for me has been, revolutionary. Like, you don't have to fly around anymore, and you can just really focus on the trip that you want to do for the investor that you want to close. So I think that's pretty cool, actually.
I know we're in our final couple of minutes. I have one last kind of closing question for the group. The phrase "check the box" has been mentioned a ton on this panel. Question I have for you is: do you feel that is falling away, and people are approaching it more like on each other's investment terms, or are you still seeing the same prevalence of sometimes the check the box attitude? Like, we'd love to get your closing thoughts on that. And I'll go to Shilpa first.
Yeah, I think we're seeing both. I mean, I think it really depends on the investor. We're seeing both, that some are kind of looking for that check the box. They're not as well educated in the space, and if they've made an investment, for example, in let's say birth control, that's a conflict with family building services, and so, and you know, those are not necessarily the investors that we're probably looking for, because you know, we're looking for the ones that really understand the differences and that multiple companies can kind of provide complementary services or products, and investment company can make investments in those companies. But we are finding that more and more companies, and I'm going to say this also again, particularly in light of the success of a company that has successfully IPO'd in the fertility and family building space, we're seeing more interest, genuine interest in what we're doing, and we have that precedent to sort of fall back on. And that's less of a check the box; it's more of an interest, a direct interest. And so, to answer the question, we're seeing both.
60 seconds left. Anyone else want to add any parting thoughts on that?
I would just maybe say that, you know, further to what Shilpa was saying, you know, one thing is that we are seeing the both. I think the good thing is its trend is in the positive direction. I think there is a lack, and this goes back to your education comment, there is a lack of understanding of women's journey in various aspects, right? What I mean by that is, for example, when I talk about, oh, we have postpartum depression, but we have a postpartum, well, that's very different from mental health, right? So I think that's just understanding and knowledge about the journey of the woman in various stages and what are the need, like what we call patient journey. I think that education as it comes, we will see more and more, less check the box, but rather a true understanding of how various things are complementary and various companies can be.
Oh, great. Well, so I want to thank you all for taking the time to speak on the panel today. It's been a pleasure speaking with each of you. And I believe Becky is going to be jumping in any second now to kind of give some closing thoughts.
Hi, Peyton. Yeah, thank you so much. Obviously, not much more to say other than what's already been said. Fantastic panel, some brilliant insights. Thank you so much for taking the time to speak to us, and to obviously the fantastic attendees that we have here today. As I keep on saying throughout these 2 days, I do encourage everyone to reach out, make those connections, whether it's over sort of the platform here today, or whether it's over email, LinkedIn, or as we've been discussing, maybe Zoom. But for now, that's it from me and from the panel. Join us in a mere 30 minutes for our next session, where we'll be having a fireside chat with Organon. So we'll see you then.